At the time when I did this master in palliative care, I was still doing my training in Portugal, in Lisbon, and indeed I think it's a very important competence for any medical oncologist to have a clear understanding on how to communicate, on how to manage expectations in end-of-life care, which is there. We know breast cancer, despite all the advances we made during the last decades, it's still in some cases an incurable disease. So at some point we need to address this with our patients and families. So as any other cancer disease, it's important to be ready to have these conversations, this management of expectations. In breast cancer, and we know that two subtypes, this is probably the setting I would like to raise more attention for, because it's also an area of interest, which is the setting of brain metastases. We know that two subtypes of breast cancer have a high incidence of brain metastases, such as HER2 positive and triple negative breast cancer. It's a very sensitive moment of the disease course, where we know that usually has a very short prognosis in terms of survival, and also impacts a lot on the quality of life of patients with the treatments that we have available to these patients. Fortunately, and this is a good thing, we have more and more systemic treatments being shown with activity in brain mets, which is something that's shifting a bit the panorama in brain metastases. And we are also interested at Institut Jules Bordet to better understand this setting with a study that we have now recruiting, which is BrainStorm, which is a molecular clinical pathological screening program for brain development of brain mets. So with the inclusion of patients with high risk of developing brain mets and patients already with a diagnosis of brain mets, to understand the epidemiology of these events, and also to understand how we can correlate not only clinical features or baseline features with development of brain mets, but also molecular data from tumor tissue and liquid biopsies from blood and CSF that is collected when the patients develop brain mets. So it's a very critical setting in terms of palliative care, because it's a moment where we need to consider having difficult discussions with patients, and it's important to have more data to better prognosticate and better inform the patients on the decisions we need to make. And it's good that we have more data now showing that systemic treatments will also help us in breast cancer, in patients with brain mets and from breast cancer, to control the disease and delay more intense local treatments such as whole brain radiation therapy that we know that affects a lot the quality of life of these patients.